If you are older and do not ejaculate, do so immediately. Urologist Explains. Gentlemen, I am Dr. Narita, a urologist who has dedicated 12 years to the intricate and vital field of men's health, spanning every stage of life, and I address you today with a message of paramount importance, particularly if you are navigating life beyond 50, 60, or even further, and have noticed a distinct and potentially unsettling alteration in your intimate experiences. Specifically, this might manifest as the profound subjective sensation of climax and intense pleasure, yet without the expected and customary physical presence of seminal fluid. This experience, which perhaps first manifested as a solitary incident that instantaneously created a knot of worry in your stomach, or perhaps has evolved into a recurrent, silent, and deeply personal concern that you have meticulously kept to yourself, often fostering feelings of shame, inadequacy, or a quiet, persistent fear about its potential implications for your overall health and well-being, absolutely demands our immediate and serious attention. My primary objective in this crucial conversation is not only to provide vital medical information, but also to offer profound and unwavering support, ensuring you understand that the change you are now observing within your body is absolutely not a definitive sign that your masculinity has expired, nor does it signify the inevitable end of your intimate life. Rather, I urge you to conceptualize this phenomenon not as a failure of your body or your virility, but instead as a highly specific, intricate, and detailed message that your body is diligently sending to you, a message that simply requires careful and informed decoding. It is imperative that you remain engaged with this discussion, as in the comprehensive minutes that follow, we are poised to meticulously explore the often surprising underlying causes of this condition, to identify the critical warning signs that necessitate prompt medical intervention, and most importantly, to illuminate the clear, eminently manageable, and effective solutions that modern medicine generously offers to restore your essential peace of mind, rekindle your confidence, and significantly enhance your overall well-being. Before we delve into the intricate nuances of what precisely transpires when seminal fluid is conspicuously absent, let us first undertake a concise yet comprehensive, non-textbook exploration of the sophisticated biological process as it should normally and seamlessly function. To fully understand this remarkable mechanism, picture your body's intricate reproductive system as a meticulously synchronized and perfectly timed orchestra, where each instrument and section plays a critical and indispensable role in a grand biological symphony. In this symphony, the testicles serve as the primary producers, diligently generating sperm, the fundamental components of male fertility. Complementing this, the seminal vesicles, a pair of glandular structures, contribute the substantial bulk of the nourishing fructose fluid that provides energy and motility to the sperm, forming a significant portion of the ejaculate volume. Simultaneously, the prostate gland, a small but vitally important organ, adds its own protective fluid, replete with enzymes and other biochemical compounds meticulously designed to enhance sperm viability and facilitate its journey. This meticulously composed final cocktail, a complex and essential mixture of sperm and various glandular fluids, is then carefully gathered and temporarily stored within the urethra, patiently awaiting its moment of expulsion. When the moment of climax arrives, a remarkable feat of neuromuscular coordination precisely unfolds. A precise and powerful rhythmic sequence of involuntary muscular contractions, primarily involving the muscles of the pelvic floor and the base of the penis, commences, serving to powerfully propel that fluid mixture forward and outward, culminating in the distinct physical act of ejaculation. This entire event, from its neurological initiation deep within the brain to its physical culmination, is a remarkably rapid and exquisitely coordinated process, the direct result of delicate, synchronized timing between an intricate network of nerves, specialized glands, and powerful muscles, all working in perfect harmony. Now, a crucial distinction, gentlemen, must be emphatically made. The terms climax and ejaculation are, in their purest physiological sense, not synonymous, although they are often perceived as such due to their usual simultaneous occurrence. Climax, more accurately termed orgasm, is fundamentally a neurological sensation, an intensely pleasurable subjective experience governed by the complex interplay of your brain's reward centers and your central nervous system. Ejaculation, conversely, is the distinct physical act of expelling the seminal fluid from the body. For the vast majority of your life, these two distinct events typically transpire so seamlessly and concurrently that they are experienced as a singular, unified event. However, it is vital to fully comprehend that they are in fact driven by separate yet intricately interconnected physiological mechanisms. Our precise focus today is on the phenomenon technically known as dry ejaculation, a medical term used to describe the specific situation where a man successfully reaches climax, experiencing the characteristic and intense sensation of pleasure, yet observes little to no seminal fluid being released. In the quiet, confidential confines of my office, patients frequently articulate this experience to me as an empty orgasm, a deeply unsettling sensation where the anticipated physical validation of the climax is conspicuously absent. This palpable and often distressing gap between the expected physical reality and the observed experience inevitably fuels significant worry and apprehension, and I assure you, I entirely comprehend the depth of this concern, as throughout life, there is an ingrained expectation for a tangible physical sign accompanying this peak intimate moment. However, it is critically important to understand that your fundamental ability to feel profound pleasure can and often does remain entirely intact, as it is primarily governed by the intricate workings of your nerves and brain. The observed change lies not in your capacity for pleasure, but rather in the mechanical delivery system of the fluid, an alteration in mechanical delivery that should absolutely not be interpreted as a loss of your virility or a decline in your masculinity. It simply signifies that a particular component of your body's intricate plumbing system has a specific, often identifiable reason for this change. Let us briefly pause before we meticulously enumerate and elaborate upon the main causes. And if you are finding this information to be genuinely helpful and enlightening, I kindly request that you express your appreciation by hitting that like button, a simple action that effectively communicates to YouTube the importance and relevance of this video, thereby extending its reach to more individuals who might significantly benefit. Furthermore, I invite you to subscribe to join our rapidly growing community, a brotherhood of men committed to understanding and profoundly improving their vital health. And please take a moment to drop a comment below, sharing with me where in the world you are currently watching from, as I genuinely cherish seeing this expanding brotherhood of men supporting each other across continents and diverse backgrounds. Now, let us proceed to meticulously break down the three most common and primary causes of dry ejaculation, as gaining a clear and comprehensive understanding of the why behind this condition is invariably the crucial first step toward regaining a profound sense of control and enduring peace of mind. The first and perhaps most prevalent of these causes is medically termed retrograde ejaculation, often colloquially understood as a situation where the body's gatekeeper is too relaxed. To fully grasp the underlying biology, envision a small yet vitally important muscular valve, an anatomical gatekeeper, strategically positioned at the internal exit of your bladder. Under normal physiological circumstances, during the profound neurological and physical cascade of climax, this muscular valve should instinctively and powerfully clamp down, tightly, effectively sealing off the bladder's exit. This precise and timely closure ensures that the seminal fluid, following the path of least resistance, has only one designated route, to egress forward and out through the urethra. However, if this delicate muscular valve is overly relaxed, or if its functionality is compromised for any reason, the seminal fluid, instead of being propelled outward, will follow the path of least resistance backward, flowing directly into the bladder. In such a scenario, you will unequivocally experience the full, unadulterated pleasure of climax, as the neurological and cerebral components remain fully active. Yet, because the seminal fluid does not exit the body, the intimate experience feels distinctly dry. A common, practical, and typically non-alarming clue that often points toward retrograde ejaculation is the subsequent observation of your urine appearing notably cloudier immediately following intimacy, as the seminal fluid has now mixed with it within the bladder. The practical causes for this condition are varied and significant. It frequently arises as an unintended consequence after certain surgical procedures performed on the prostate or bladder, particularly those that involve the delicate bladder neck region, such as transurethral resection of the prostate, TURP, for benign prostatic hyperplasia, BPH, or bladder neck incision. While these procedures are often highly successful and medically necessary for addressing specific health issues, they can inadvertently affect the delicate network of nerves that precisely control the muscular gatekeeper, altering its ability to contract effectively. It is also a well-established side effect of specific classes of medications, notably alpha blockers, which are commonly prescribed to treat conditions such as high blood pressure, hypertension, or an enlarged prostate, BPH. These medicines are designed to relax smooth muscles and blood vessels, or the prostate itself, but they can, as an unintended consequence, also relax the tiny muscle of the internal urethral sphincter, leading to its dysfunction. I vividly recall a patient, a man of immense pride, who initially felt utterly distraught following what was otherwise a highly successful prostate surgery, when he was gently guided to understand that his experience was purely a mechanical alteration, akin to a traffic light being stuck open rather than a failure of the engine, and that his fundamental desire and profound ability to feel pleasure were completely unaffected by this change in fluid mechanics. He expressed immense and palpable relief, his previous anxieties visibly dissipating. This understanding liberated him from self-blame and allowed him to adapt to his new physiological reality with restored confidence. The second major cause we must address involves a physical impediment, a blockage within the delicate plumbing system known as duct obstruction. In this scenario, the fundamental biology indicates that the seminal vesicles and other accessory glands are continuing to produce seminal fluid entirely normally, as the production machinery remains fully functional. However, envision the small, intricate ducts through which this fluid must pass as fine delivery pipes within your body's complex system. If these critical pipes become blocked or significantly narrowed, the delivery vehicle, the seminal fluid, simply cannot pass through effectively. Consequently, the volume of ejaculate drastically decreases or even disappears altogether, even though the production process itself remains perfectly intact. The practical causes for these blockages can stem from various sources. One common culprit is the scarring left behind by past infections, particularly severe, untreated, or recurrent episodes of prostatitis, inflammation of the prostate gland, or epididymitis. These infections can lead to fibrosis and strictures within the ejaculatory ducts or the epididymis, effectively creating bottlenecks. Less frequently, small calcifications akin to tiny stones or concretions can form within the ducts and physically impede the passage of fluid. These blockages can also arise from congenital abnormalities, although these are rarer in older men, or from cysts that form within or adjacent to the ejaculatory duct system, further obstructing the path. The practical signs and symptoms accompanying duct obstruction can be subtle and insidious in their onset. Some men might report experiencing a new, mild, yet persistent discomfort or a dull ache in the deep pelvis or perineum, specifically during climax, which was not present before. Alternatively, they may have gradually noticed over an extended period that the seminal fluid has become progressively thicker, more viscous, and significantly less abundant, indicative of a partial or worsening obstruction. The excellent news for those affected by this condition is that many of these obstructions are treatable and can often be cleared. Treatment strategies may initially involve medication to effectively manage and reduce inflammation, particularly if an underlying infection is suspected or present. If medication proves insufficient or the blockage is structural and persistent, minimally invasive procedures, such as transurethral resection of the ejaculatory ducts, TURED, or specialized prostatic massage techniques can be skillfully employed to physically clear the obstruction and restore the normal, unimpeded flow of seminal fluid, thereby alleviating the distressing symptoms and restoring vital functionality. The third significant area that absolutely warrants thorough investigation when considering the causes of dry ejaculation pertains to crucial hormonal factors, primarily focusing on the impact of low testosterone, often evocatively described as the fuel is low scenario. From a biological perspective, testosterone stands as the primary and most vital androgen, serving as the essential fuel not only for the entire male reproductive system, but also for numerous other critical bodily functions, extending its influence far beyond merely regulating sexual desire, libido, and stimulating sperm production, spermatogenesis. Testosterone is, in fact, absolutely crucial for the optimal structure, health, and functionality of the prostate gland and the seminal vesicles, the very organs that contribute the vast bulk of the seminal fluid volume. When circulating testosterone levels experience a significant and sustained drop, the entire intricate male reproductive system, along with various other metabolic pathways, begins to slow down and operate suboptimally. The emotional and physical impact of this decline can be profound and multifaceted. Initially, a man might observe a discernible reduction in the volume of ejaculated fluid, a subtle harbinger of the underlying hormonal shift. However, over a more prolonged period, this testosterone deficiency, clinically known as hypogonadism, can manifest as a broader constellation of symptoms, including a noticeable decrease in libido, a reduced intensity or frequency of spontaneous erections, and a generally less intense or satisfying sensation of climax. Beyond these direct sexual health impacts, men suffering from low testosterone often experience pervasive fatigue that goes beyond simple tiredness, significant and often unexplained changes in mood, such as increased irritability, persistent depression, or a general lack of motivation that impacts daily life, a troubling loss of muscle mass despite regular activity, an increase in stubborn central body fat, and a reduction in bone mineral density, leading to increased fragility. The practical solution for hypogonadism, when unequivocally confirmed by appropriate diagnostic blood tests, often involves carefully managed hormone replacement therapy. This therapeutic approach, under strict and vigilant medical supervision, can frequently restore not only better seminal fluid production, but also a robust sense of energy and vitality, a rekindled sexual desire, improved erectile function, and an overall enhanced quality of life that can be truly transformative. It is a profound and common mistake to simply attribute these symptoms and changes solely to the inevitable process of getting old. While aging can certainly play a role in hormonal decline, clinically significant hypogonadism is a distinct and treatable medical condition, and an accurate diagnosis followed by appropriate intervention can often reverse many of these distressing symptoms, significantly improving a man's overall health trajectory. While the vast majority of cases of dry ejaculation, as we have just explored, arise from manageable causes, as your medical doctor, I bear the crucial responsibility of addressing the critical exceptions. Dry ejaculation, under certain circumstances, can indeed serve as a significant red flag, signaling the presence of a more serious underlying medical condition, which is precisely why paying meticulous attention to any accompanying symptoms is absolutely crucial. You must make it an urgent priority to see me or any qualified urologist immediately if dry ejaculation manifests suddenly and without any clear or obvious explanation, especially if its onset is accompanied by additional concerning symptoms such as severe pain in the genital or pelvic region, the visible presence of blood in the urine or in any seminal fluid, the development of a persistent fever which could indicate a severe infection requiring urgent treatment, or, most alarmingly, a sudden loss of sensation or numbness in the genital area. These are potent and unmistakable signals that demand an urgent and thorough urological evaluation without any delay whatsoever. Conditions such as certain progressive neurological diseases, including Parkinson's disease or multiple sclerosis, or poorly controlled and long-standing diabetes, which can lead to widespread nerve damage known as neuropathy, affecting ejaculatory mechanisms, or, in extremely rare but important cases, specific urological cancers such as prostate cancer or testicular cancer affecting ejaculatory ducts, can profoundly interfere with either the intricate plumbing system or the delicate nerve signals responsible for normal ejaculation. Swift diagnosis and intervention in these scenarios can be life-saving or can significantly impact the long-term prognosis and quality of life. Beyond the purely physical and physiological aspects, we absolutely cannot afford to ignore the profound and often debilitating emotional toll that dry ejaculation can inflict upon men. Societal expectations and deeply ingrained cultural narratives frequently equate the visible presence of seminal fluid with a man's performance, his fertility, and indeed his very virility, creating an undue pressure. When this expected physical manifestation disappears, it can tragically give root to deeply unsettling feelings of inadequacy, intense anxiety about sexual encounters, profound frustration, and a pervasive sense of loss or incompleteness that can permeate other areas of life. It is lamentably common for men experiencing this condition to begin subtly or overtly avoiding intimacy, driven by an overwhelming fear of being judged by their partner, or by an internal sense of feeling incomplete or broken. This avoidance can lead to significant strain in relationships, erode self-esteem, and diminish overall quality of life, creating a vicious cycle. The emotional reassurance that I wish to impart to you is that the single most important and empowering step toward breaking this self-perpetuating cycle of anxiety and avoidance is through the dual power of accurate information and open communication. Gaining a clear and informed understanding that this is fundamentally a physiological change, a medical condition, and emphatically not a personal failure, lifts an enormous and oppressive weight from a man's shoulders, allowing for healing. It is paramount to internalize the truth that your inherent ability to feel profound pleasure, to achieve and maintain firm erections, and to enjoy deep and meaningful intimate connection with a partner does not solely or even primarily depend on the physical presence or volume of seminal fluid. Your intimate life can and unequivocally should remain a vibrant and fulfilling source of joy, connection, and emotional closeness, enriching your life in myriad ways. This understanding empowers you to redefine intimacy beyond a singular physical aspect and to focus instead on the richness of shared experience, emotional bonding, and mutual satisfaction. To bring our comprehensive discussion to a conclusive point, I want to leave you with a clear, supportive, and actionable plan designed to empower you to take back profound control of your health and overall well-being. Firstly, and crucially, do not ignore this symptom. Rather, commit to investigating it thoroughly. The sudden or progressive onset of dry ejaculation absolutely warrants a prompt visit to a qualified urologist. During this visit, a simple yet comprehensive patient history, a thorough physical examination, which may include a focused genital and rectal exam to assess prostate health and anatomical structures, and often a straightforward blood test to assess crucial hormonal levels or a urine test to check for infection or retrograde flow, are typically all that is needed to arrive at a clear and accurate diagnosis, thereby setting you firmly on the path to appropriate individualized treatment. Secondly, take proactive and disciplined steps to control any underlying chronic conditions you may have. Chronic conditions such as diabetes, high blood pressure, hypertension, and high cholesterol directly and significantly impact the delicate vascular health and nerve function that are indispensable for the entire ejaculatory process. Meticulous and consistent management of these conditions through prescribed medication, a healthy diet, and consistent lifestyle modifications can play a pivotal role in preventing further deterioration and robustly supporting overall urological health and systemic well-being. Thirdly, and perhaps most liberatingly, break the silence. Engage in open, honest, and courageous conversations with both your partner and your trusted doctor. Articulating what you are feeling, your concerns, and your observations is an immensely liberating act that invariably paves the way for effective solutions and strengthens your support system. Remember, professional medical support, whether it involves a simple medication adjustment, a specific therapeutic intervention, or even a targeted surgical procedure, is unequivocally your best and most powerful tool for restoring confidence, reclaiming your intimate life, and significantly enhancing your overall well-being. In summary, gentlemen, the observed absence of ejaculation is definitively not the terminal end of your intimate life, nor is it a final verdict on lost masculinity or virility. It is instead a profoundly important signal emanating from your body, a message that unequivocally deserves to be heard, understood, and meticulously investigated with the expert assistance of a professional urologist. Understanding the precise underlying cause, whether it is mechanical in nature, such as retrograde ejaculation, obstructive due to blockages in the ducts, or hormonal, like low testosterone, constitutes the fundamental first step toward finding lasting peace of mind and regaining absolute control over your health. I have personally witnessed countless men, through my years of dedicated practice, successfully regain their confidence, their vitality, and their profound joy in living after receiving a clear, accurate diagnosis and embarking upon a tailored, effective action plan. Your true vitality, dear gentlemen, is not and never will be measured solely in milliliters of seminal fluid, but rather in the robust quality of your overall health, your holistic well-being, your unwavering confidence, and your profound ability to live life fully, engage deeply, and connect intimately with others. Therefore, do not allow doubt, shame, or fear to prevent you from actively seeking the answers and the expert care you profoundly deserve. Acting promptly and proactively can comprehensively transform your experience, effectively restoring the security, confidence, and intimate connection that are fundamental to a rich and fulfilling life. If you have found significant value and insight in this crucial message, I implore you to share it widely with a friend, a father, a brother, or any man in your life who might significantly benefit from this vital information, as this knowledge truly possesses the power to change someone's perspective and life trajectory for the better. Please leave a like to help this message reach an even broader audience of men who desperately need it, and I encourage you to subscribe to the channel, ensuring you turn on notifications so you never miss our upcoming and valuable content on men's vital health. Always remember, your best years, your most fulfilling moments, can still be ahead of you. Be proactive in your health, be confident in seeking solutions, and stay blessed. I am Dr. Narita.